The Knox County Hospital District is the provider of health care in Knox County, and we are important because if you have a heart attack, if you have a car wreck, we're able to stabilize you and get you to a tertiary care facility and give you a chance at surviving a traumatic event. We're able to take care of your child who has the sniffles, and that you can bring to our clinics, and we can take care of that locally. Our outreach is through our clinics, but then we've also broadened our outreach to be able to bring in lab samples from throughout the state of Texas, and to give access and I think better care for all Texans. 2 to 3 years ago, I started looking at our finances and thought, if we don't figure out a way to look outside the box and to provide services or be able to expand our services in a way other than the typical hospital, clinic, EMS type environment, that we weren't going to survive. And so we have expanded our lab. We expanded our lab because I felt like we could bring in additional revenue, but at the same time we could provide a better service to the provider by giving him results that were timely, accurate, and the same every time. I felt like at the time we could not only better our financial position, but that we could provide a better service for everyone throughout the state of Texas.
We are a level 4 trauma center, and with that being said, we hold our nurses to a higher standard. They are required to have TNCC, which is Trauma Nursing Core Course. All of my RNs have TNCC, ACLS, which is Advanced Cardiac Life Support. They have PALS, Pediatric Advanced Life Support, which the hospital pays for. I think our contribution is when you come in here, you're treated like family. Chances are we know the majority of the people that walk in these doors. We do offer outpatient lab services. Those services are available through our clinic, through our emergency department, through observation, inpatient. A physician from another town can order your lab and you can have it drawn here versus having to drive to a bigger city.
What we fill in is we offer local small town service on a big scale to people that are used to getting big town services. And what that does is they're able to call us. We have 5 employees here in the lab. They're able to call us and speak to someone in the lab to ask a lab question, to get the results, to get specimen requirements or anything like that. They can call. They know they're going to speak to one of 5 people every day. We have state-of-the-art equipment here. We actually run the same equipment here in our hospital that they do at the LabCorp, which is the largest lab service in the world. I mean, they do millions and millions of samples a day on the same type of analyzer that we have just down the hall. That takes the guesswork and the conversions out of the doctors when they're treating the patients. I don't see there's not a loser in this deal. It's all about patient care and health care first. I mean, that's what everybody wants. They want the best that they can get the providers want the best that they can get for their patients. And that's what we give them. We have a shorter turnaround time, offer great service, great customer service. And what that does is that gets the results to the doctor so he can treat the patient faster. And that's what they want. I don't see there's not a loser in this deal. It's all about patient care and health care first. I mean, that's what everybody wants. They want the best that they can get the providers want the best that they can get for their patients. And that's what we give them. We have a shorter turnaround time, offer great service, great customer service. And what that does is that gets the results to the doctor so he can treat the patient faster. And that's what they want. Hey, we run the same test here, same analyzers here, all of that stuff. We offer it. Your provider has chosen us because we offer local service to him, and he has a contact here in the lab that he can speak with directly. So him and his nurses, like I said, they know us on a first name basis.
It's very critical to our little to the whole county for saving lives, getting people to the places where they need to be to take care of them. And I've had an experience here where I was having trouble breathing. I had to be intubated and care flighted out to Wichita Falls. And when you're in an emergency situation, time is critical. And it just saves lives to have it closer. We don't know what we have sometimes until we lose it.